This is a therapy session. You do know that. So you might be a physio, but this here is a therapy session for the person you're interviewing. So everything that you talked about is how do we do this as physios, you just did it. You listened to my story. That's it. So as a podcaster, translating this to other people, you have that gift of presence. That is the therapeutic alliance. Right what you did today. So I don't know if you realize the potency of your podcasting, but it's pretty awesome. Yeah. So thank you. Thank you for the honor and the privilege, and it's exciting.
Thank you.
Do you want this in? Is that okay?
It's fine.
It's fine.
I like it.
Isn't it great? It's from Santi.
She got you.
Yes, you did. Isn't that beautiful? I love it. I use it all the time. Hope. And we'll put it right there. That's going to be my symbol.
What is it?
Hope.
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 What does it mean to you?
Hope means that every day holds an opportunity for newness, even amidst uncertainty. You have hope.
Newness, even amidst.
Even when life is uncertain, you have hope.
And then why the butterfly?
Because everything metamorphosizes. If you're a little cocoon, coming out of your cocoon, you have the good fortune to fly anywhere you wish.
You're so poetic. She's so poetic.
It's kind of like...
Let me know if it's audible. Is it audible? Okay, I'll just ask this activity as well.
That was beautiful, by the way.
That was so beautiful. I'm gonna have to. I'll keep it in.
Did you record that? Was that recorded?
It is recorded.
Oh, it really is from the heart, though. That's how I feel about it. Yes.
About hope. And what keeps you hopeful?
Every day when I wake up and I have the opportunity to be with those I love and inspire my students, my patients, my family, not in any specific order because they all happen when they emerge throughout the day. That gives me not just hope, but joy.
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 I heard something that there's a difference between happiness and joy. And happiness is dependent, I think, on the situation, and then joy is internal.
Exactly. And I would say that happiness could be, I could be happy in a situation, but the joy is a deeper soulful meaning, that you could be filled with joy and actually not be in an optimal situation. So happiness isn't always the precursor for joy. Because joy could actually just be, I'm joyful that I'm taking a breath, or I'm joyful that I'm sitting here with you right now. I'm joyful that I have my sister Santi in my life to make this experience here in South Africa vibrant and alive, to make others happy, and then they experience the joy. So joy is a much deeper, soulful meaning to me.
It is. It's less fleeting than happiness would be.
Yes, exactly.
And where do you draw or pull from?
Ooh, that's such a great question. I would say from my faith and trust that my higher power, my God, really just takes me to the next level as to what I'm to do. And I ask every day, how am I to serve? And then I have to trust the answer. I pray, I trust, and then it's so much fun to feel guided. Just guided, it just happens. Like you just happened in my life last week. You were there around the table and suddenly you became part of the experience of our work, our collective work. We deepened that the next day when we were at Bara, right? We were there doing that together, and then we talked about life in my world and your world here. But what a great deepening each time we connected. So that's what fuels me, is We meet, and even if we meet for a moment that I never see you again, it touches me. And your commitment to be part of this circle of strengthening cancer rehabilitation and moving the agenda forward to serve others who may never have heard about this opportunity. That's when you get to touch someone else's life, which is really what it's all about. Is humanity begetting humanity, touching hearts and souls, and being able to make a difference, just to make a difference, small or great, doesn't matter. It's not about the volume. It's actually about the ability to be present.
You've mentioned trust and you mentioned hope.
Here's my
Your hope
motto.
tumbler.
Yes, my hope tumbler. Thank you, Santi.
And also the call to serve, which isn't the most glamorous one, I would say, because I think from having been in positions where I serve as well, there's always with people, there's always expectations of being glorified, I guess, when you serve people, but servanthood is a lot more deeper than that, and sometimes thankless in the traditional sense.
It's a very interesting perspective, and then we could switch it to servant leadership. So when you're a servant leader, the accolades aren't necessary. The need for recognition just isn't there because it's so deeply internal. It's so much a part of the essence of existing, actually. Funny that I should say that. Just the very essence of existing is the call to do that, because when I serve, I get so much more. It's quite circular. It's not serving for the purpose of something.
Yes.
It's serving for the purpose of being here right now. What do you need? What do you need? Tell me, where can I support? And then sometimes what you will say about your need then touches me, fuels me, surprisingly. And that's the best part of all, is it's fun, because it's when we are not having an end goal for that service, it just simply is organic and it emerges.
People in health, I think the expectation for healthcare professionals is, you expect healthcare professionals to be servants, serving the community, serving their patients in all aspects. But I think sometimes I've seen at least from experience, that there are healthcare professionals who thrive a lot more from the technical side of things, higher IQs. And last week I was actually faced with, I came across this on the internet, where the question was, if you had to choose, would you rather have high IQ, low EQ, or low EQ and high, what is it? The opposite, or the opposite. So high IQ, low EQ, or high EQ and low IQ. Which one do you think you'd?
I would say the latter. Having a high EQ gets to that essence of being with you in a different way than just delivering my highest IQ information, this, and this, because if we can't connect it to anything meaningful, what's the purpose of why we're here? So I will take high EQ over
IQ.
the IQ.
Any day. And then in your experience as a therapist and also in academia,
Yes.
how have you found EQ to be beneficial for you?
Because I listen to the story of either my student in the classroom or my patient who's before me, because they will tell me their story. Because without that and without being present, then I can't serve them. If I think I know what they need, I have the skills to serve. In the technical way of my profession, I evaluate, assess the situation, get their perspective on their goals. I could put a plan together. But the plan is not going to be deliverable unless the patient feels that they trust that they're generating their perspective of how they can incorporate the plan of care. So that's the beauty of being emotionally connected and not distracted by my computer or making notes about their situation. I'm listening, and I want to truly know what will make your goals transcendent, or how we can get to meet those goals in the end. Because then I become, if I don't have the authentic essence of who you are, how do we meld that to reach your highest good?
My highest good.
If you were sitting here before me as a patient or as a student at any level, it's like, tell me what you're passionate about, and what is it that you want for yourself, and how do you want to express yourself in the world? Now, they do sound philosophical. It sounds philosophical, but at the end of a technical deliverable of a plan of care, or your degree, or this outcome of your master's, et cetera, the momentum that underpins that is your excitement, your passion. How did I get involved in this? And I may also add one thing. I will say that there's a dose of serendipity in there. How did I get here? Like, wow, this is really kind of interesting,
Yes,
right? Like,
yes.
wow, this is really fun. And so I could take you back a little bit to my work in the AIDS pandemic, because, well, no one really wanted to treat. They were afraid. Everyone was fear-based. We all knew that in COVID, but lucky me, in my lifetime, I got to see 2 pandemics. But there was a calling in that moment when I saw people my age dying. So I could not treat them. So there's a calling and a serendipity and a need that I could see. Oh wow, let's go. Where can I serve? How can I help? And I think coming from that place is, maybe it's just been who I have always lived my life, but every interaction, every opportunity seems to get deeper and deeper. So that's what's fun.
I was actually going to ask you if it's always been like that, because if it's always been like that, because sometimes you get into a profession or any industry with other prospects or like dreams, and then the calling, I guess, finds you while you're in it.
I actually feel like I'm one of the luckiest people on the planet, because I have never awoken in a day not wanting to go to work. I'm going to be honest and tell you that, unless I was ill or something. But I wake up and say, hey, what do I get to do today? Whether it's teaching or seeing a patient or sitting with my colleagues and writing a manuscript and looking at data together and saying, what is it that we're finding? It's always like it's like a gold mine. What are you going to mine today that gets to uplift humanity? Right? Lucky me. Did I get lucky, or was it intended, or was it divine intervention, or is it serendipity? It's all the same. It's happening. So sometimes I think we don't have the words.
Yeah, to explain it. Nor should we actually try to get to the bottom of it if you feel like you're living in your purpose. So I went back, I think after our first conversation on Monday, I went to go look at the TED Talk.
You did. You did your homework.
I did. Usually I try not to, but I was like, I mean, this is a big deal. I've never met anyone who's done a TED Talk before, so it was the first time. And I went back to watch it, but I didn't want to get too into it or like analyze it. I just took
Sure.
the overall story. Just for starting, how did that come about?
You
That's
see,
a pretty
Pile,
big
that's
deal.
interesting. So my university wanted to have a representative at this particular venue that were doing TED Talks. And so they came to me because they said, you're a cancer survivor, you're a cancer researcher, you're a cancer clinician. You could give a perspective both as someone who's an expert clinician in this area of oncology rehabilitation, then you became a patient, or then your husband had stage 3 head and neck cancer, and you're doing a lot of research on this, so it's a kaleidoscope of, can you speak to that? In addition to that, I had just finished my postdoctoral fellowship from the National Institutes of Health in the National Center for Complementary and Integrative Medicine. And in my own journey, from the eyes of the patient, I realized what was missing in Western medicine. And then I wanted to know how I was going to integrate meditation and yoga and perhaps various supplements that were in complementarity with my treatment regime to reduce the side effects. So I did everything I could do along the way to meld both Western medicine and integrative oncology. And so I think how I was asked is that I've had so many lenses in the world of cancer that they said, would you step up and do a TED Talk? And I said, this is decades of my life. You're asking me to put it in 18 minutes. That was not easy. And interestingly enough, it took months to be able to get clear and what is the message? And interestingly enough, the word survivorship, I was at that time was struggling with the word survivorship. So I really wanted to shift a little bit of the language. Survivorship means like, I'm surviving and floating and trying to make it to survive and live above water. Thriving is a more vital word. So I was trying to change a little bit of the narrative, and I opened up the conversation as everyone I touch is surviving something, but are they thriving? I can survive it, but I may be exhausted. I may not be living my life to full vitality. And as such, am I really living if I'm just surviving? So I was really, when people would then give me the label, oh, you're a survivor. It's funny that it's just in the world of cancer survivorship. I don't know how we claimed that word, but someone with diabetes is surviving their insulin levels, checking their blood glucose levels. That's survive every day. Someone with Parkinson's is struggling with the neurodegenerative decline. Someone with Alzheimer's. Everyone's surviving something. So I think I wanted to change the narrative. So that's how it all happened. And it was actually fun because I had people like you. We went to our theater department who basically coached me in keeping it short. I had a long storyline, and then that was the nice part, to be able to have other people help me be able to deliver a TED Talk. I learned a lot
from that. I think what I picked up from the talk and even from last week's presentation in the workshop, like you have a lot of accolades and a lot of achievements. And I remember I was speaking to some therapists prepping for the workshop. They were excited. Prof is coming. Prof Galantino is coming. But I think what made it even richer, beyond just the academic knowledge of it or the theoretical knowledge, is the experience and how you're able to deliver from the patient's perspective. Because having a lived experience does give you a lot more insight, understanding, empathy. I mean, on top of the fact that you have a lot high EQ, but having lived through it kind of changes how you even deliver the talk. And just taking it back to, you mentioned in the video that you were part of a system that failed to catch your cancer. How was that for you?
That, quite frankly, in the midst of it all, felt a bit like a betrayal of the system that I had served, to be very honest. Because if I said I felt this here that's palpable, I know that it's not part of my breast tissue as I know it. Even while I was pregnant, it was simply dismissed. You're pregnant, breast tissue's changing. It's okay, you'll have your baby, we'll check you later. You have cystic breasts. It was as if I believed in my own ability to know my body well enough, and then there was a bit of a dismissal around that. And then I was persistent, because even after I delivered my son, I went right to a breast surgeon. And then the breast surgeon said, it's not on mammography. We don't see it. It's not on ultrasound. I said, fine. Can you please biopsy? Why would we biopsy? You're breastfeeding your son. We don't want to disrupt that. You're fine. So then I thought, could it be that I just do this for a living, that I'm a little bit over concerned about this? And then I showed up 3 months later. And then 3 months later, negative. And then, and this is the value of clinical trials, then there was a study comparing mammography to ultrasound, and the new diagnostic on the block was now breast MRI. Lucky me that I chose to go into that clinical trial negative on mammography, negative on ultrasound, and there was the tumor on MRI. So it took my diligence and persistence to say, let me check and check again, and please, doctor, please, breast surgeon, please, let's get to the bottom of this, so that we could get an answer to something that I already know that's in my body that is not normal. It's not normal. So I had to actually work through a lot of emotional tumult about that, because suddenly I had a 1 and a 3-year-old. And I couldn't imagine if I was going to die from this and who would take care of my children, depending on the moment they did the biopsy, and I didn't know if it had gone into my limb system. So the urgency of knowing that I wished I had been diagnosed sooner, I could have been caught in stage 1 or earlier than that. So I had to forgive, actually, the clinicians that missed my diagnosis. And I'll be honest, that was a process.
What exactly did it entail?
Well, I think if we don't go through the stages of grieving in terms of our own emotions, that there certainly was frustration and anger that it wasn't caught sooner, and that the ability to allow myself the emotion to then, obviously I was in the midst of taking action. I really did a lot of that work after I finished my treatment, 5 surgeries, then I had chemotherapy, then I had a mastectomy because I could avoid radiation. It was almost as if that was my survival time. That was surviving, getting from appointment to appointment. Oh, by the way, I was in the middle of my postdoc fellowship at the University of Pennsylvania. That was surviving. And then when I was in the midst of even doing some of my own counseling with a cancer therapist, I realized I had to work on forgiveness. These are only machines that pick up diagnostic findings. Humans interpret. Diagnostic findings aren't 100%. Maybe in the case of mammography, 80 to 85% screening, right? We pick up for more diagnostics. Ultrasounds, a greater sensitivity and specificity of finding. But there it was. At least I was part of that clinical trial that now has breast MRI with early screening positive findings. So I'm really happy that I was able to participate in that research and also be affirmed and confirmed and then carry on about my treatment. So it was both a physical surviving and emotional processing to be able to get on the other side of healing.
And how was it having to go through that? Because I mean, you're working in the field, you have a lot of knowledge in the field, and now you are the patient. And when you're a patient, there's a lot of factors that you have to consider and emotions and feelings that you're going through. So how was it for you balancing both being a clinician who has the insights, but also being a patient who at some point or sometimes would have to surrender and give up control to trusting the clinicians, I guess?
Your word, surrender, is a very poignant statement right there. In the beginning, we, as clinicians, think we could know and plan and organize, and then you fall into the arms and you have to trust that your colleagues have you. And think about this. I came in with the distrust because I was missed. So now then I had to process and then trust that the plan of care was going to ultimately result in a cure. That was my letting go. I had to let go. I remember I had real difficulty after surgery actually raising my arm up and over, and I had pain all the way down into the thumb. It's called axillary web syndrome. And I remember turning to the physios that we trained in my own department, and then she looked at me, she said, "This does not feel right that I should be treating you." And I said, "Please do."
Yeah.
And I remember in the room sobbing, just crying, just letting it all out, because here I was really processing my emotions through my physical. Because when I do manual work, or when manual work is being done to us, the body holds emotions. There's a great book, The Body Keeps the Score. Mm-hmm. And it really speaks to that, right? We hold our emotions in our physiology. So when my physio took my arm and started working on me, it was just a floodgates of emotion, which was also part of that healing. And so touch is so important, and that's why as a physio, lucky me, I get to do that too. But being touched and receiving, that was a little harder, right? I had to surrender and let go. And that was a process. It didn't just happen.
There's a notion, or like a video I'd come across. So they were talking about friendship and vulnerability, or how to build trust in a friendship. And we always assume that offering help to your friends is what builds trust, but actually being able to ask for help from a friend is what builds trust, because it requires a different level of being vulnerable. And it does create room for a deeper connection. And I think that moment where you finally, or when the body decides, you know what, right now we're going to let the tears come out, generally would mark the beginning of a beautiful relationship that you have with your therapist.
To that point, that's what bonds you forever to that individual who was able to hold those tears and hold those moments of pure vulnerability. You know, I think Brene Brown has done a number of research studies as a social worker, really talking about our ability to be vulnerable. We don't tend to go there because society expects that we especially if you're, in a role that is a leadership role, that you're an academician and you're a researcher and you're, the expert or whatever that means, according to whatever guidelines people perceive you to be. And yet, that moment of vulnerability tends to bond at a level that none of those degrees or any of those domains I just mentioned could even measure up to that level of the moment of vulnerability.
Now, as a therapist, as a physio myself, and many other physios that are out there, the journey of firstly survivorship, but also with the objective to get to thriving. You said it. I'm adopting that just by the way. Thriving. It's multifaceted, and there's many components to it. What exactly is our role as a physiotherapist in that journey? What does it look like, from your experience and from what you've gathered and seen?
So how do you get there to that point of vulnerability? Well, I think firstly, we really don't fully understand what the patient is going through, right? Necessarily. However, in listening to their story, we do get a window and a bit of an insight into their own journey. Right? That's the whole art of narrative medicine. There's a whole area that I think is really developing a little bit more as we evolve as humans. We have these societal, these professional norms that we stay within the constructs of. And then it's just that ability to fully listen to the story and then allow the therapeutic alliance, once you tell me your story, how I could best help you. But it's you crafting your journey. I'm just the facilitator. It's you doing it. It's not me. As a matter of fact, when I have someone say, "Thank you so much for getting rid of the pain, Mary Lou," I said, no. I didn't do that. You and I worked together. You did everything that we planned together. It's not me. I may have a set of hands here that helps to get those trigger points out and helps to reduce the sensitivity of your perception of pain. But take credit for what you did. You went home and followed the plan of care that we designed. Not me. We designed it together. So it's really it's a we, not a me, the physio, and you, the patient. We're doing this together. It's never a me or a you. It's really the patient owning that they are their own healers. And then we add the element of spirituality, if that's part of their journey, of knowing that they're sourced by an essence of spirituality that helps guide that. But then if that's part of their narrative medicine component, then perhaps we need to talk about it. There are some things that Western medicine does tend to shy away from. Because can we speak about that, or should we speak about that? And if it's on the hearts of our patients, that's meaningful, and their belief system is such that that's what brings them to their healing, let's talk about that. And I'll do a little bit of manual therapy, and we'll do gait training, and we'll climb the stairs, and we will exercise. So it's all of it. It's fun.
It's all encompassing.
It's an amalgam of everything of the lived experience that I think we're here to do as humans.
Isn't it interesting how we... so much. Isn't it interesting how we always look at diagnosis? We can name the diagnosis, okay, cancer, this and that. And somehow we forget that a patient is all-encompassing. They're a human being just like you are. And they are that before they have whatever diagnosis they're faced with. And I think it's such a simple thing, but it's simple theoretically, but it's such a complicated thing to put into play when you are in front of a patient, because you go, okay, I'm the therapist, this is the patient, I'm the expert, I have the expertise, they can give me the subjected or reported pain or symptoms, and then we treat that, but we forget that this is actually a person just like you are. They have problems just like you do, and that can be a massive barrier in whatever journey you're trying to walk with someone.
What you said right there, you are such a poet as well. You have this beautiful way with words, and walk with them. And I think what's so interesting, I also think it's very interesting to look at the hierarchy of our medical system. Right? So how do we all level the playing field that each healthcare professional is equal in the system of serving to walk along with? You're not just walking, we're all walking together for your healing. So that's why the interprofessional theme is essential, because if you need someone to process your grief and your loss, I need to make sure I get you someone that could get to that level of wherever you are along the continuum of grief or loss or anger or acceptance, whatever that is. It's my job. I could listen, but I also want to bring on other members to walk with us. So I'll change that to walking together, to then, you're really walking with your tribe and the community as well, and your family dynamics, which I will say is also a big part of how we negotiate and navigate any diagnosis. Is what's our support system? Who are we in the big scheme of things? What's my meaning? Sometimes I often will say, what would you love to do if you weren't doing this? Especially if it's a work-related injury. Think about like a work-related injury and we're trying to get them back on the job, or even an elite athlete. My son's a swimmer. My daughter was a dancer. I remember when they were, injured. How do you see yourself coming out of this with a new perspective? So if we could change the narrative, is that I'm not fixing in my daughter's case, her ankle injury from her ballet, or my son's shoulder injury from his swimming, but who do you want to be when you come out of this adversity? Those questions aren't typically asked by us as physios, right? Wouldn't you agree? Do you question like that?
It's not your scope of practice. That's what we say.
Really? But it actually is, because it plays right in to ultimate return to performance. But then we let the psychological piece come in, which actually then transforms the deliverable outcome in meeting a goal that might be beyond what they expected to have in their experience with us.
This is for, like I said, I love the fact that you can give insights into into all the stages. One as the expert in the field, but also as someone having gone through the experience as well. We meet a lot of patients that have been diagnosed with cancer,
Yes.
and a lot of the times they're told this is a terminal illness. There isn't a cure. You'll go through chemo or whatever modality, and you'll be in remission, might come back. There's all those conversations, but it feels very dark. It's like a sad topic or subject to talk about. And for a lot of them, they do lose hope and a sense of planning for the future, because the question might be, why bother if the ultimate thing is it's going to end anyway? How does one begin to crawl out of that space and become a bit more hopeful about what is to come for them?
That's a poignant question. And for each person, it's going to be different. It starts with where am I today and measuring that ability to determine, am I truly hopeless? We could even ask the question on the scale of 1 to 10, how hopeless you are. How hopeless do you feel right now? 10 being, I don't want to live anymore. What is the purpose? To even know where someone is on the spectrum. Losing hope is a normal reaction. It's what we call, getting depressed is a reactive depression to a diagnosis. It's normal. It's all normal. If we deny ourselves the emotion, then we pretend that we could move through this, or we could pretend that we could survive these treatments and then be hopeful afterwards. But processing it along the way and having us as facilitators of healing, having us ask that question, how hopeful are you today? Is a very, very interesting and rather curious, because if I'm just going to go through the motions of having someone exercise at my cancer center or in my outpatient center or at the bedside, if they're a 10, the ability to say, what do we need to resource you to even participate in physio today? So getting at that emotional level and finding where individuals are, because it's a grief, it's a loss. I had an amputation of my left breast. That's a body part that I no longer have. That grieving process takes time. It takes therapy. It takes a facilitator to help me with that. We can do that because we can ask the question and then bring in our team members. That's the beauty of the MDT and the whole storyline. And the best part of changing the narrative around cancer, cancer does not equal death. Cancer is a diagnosis, just like diabetes, just like cardiac, myocardial infarct moment, just like an orthopedic hip replacement. It's a diagnosis in this moment. And if we can begin to change that narrative around the fact that we will move through what treatments are available for success and NED, no evidence of disease, that's where we want to go, then we live in the next stage of being able to continue to build that hope if they did score at a high 10. But it's the anatomy of hope. We have to dissect it. The anatomy of hope. Where are we right now? What can I do as your partner in your healing that could provide a way for you to reclaim your body, number one, and have hope that you could pick up your child to do all the things you want to do in the playground with them? Because my children were 1 and 3. I just wanted to be a mother. Put aside all my other degrees. That didn't matter anymore. I needed to be a mother. So I needed to be able to pick them up. Oh, no, you can't pick up anything more than, 20 pounds or you're going to get lymphedema. Like, I'm picking up my child. So that would make me depressed if I was told I can't pick up my child, right? So all the quote, you can't pick up, and now that's been dismissed. The whole storyline in our research in lymphedema, that narrative has changed. Exercise is important to prevent lymphedema. So I think starting right where the individual is as they present to us. Understanding the scope and the depth of that hope or depression or grief or fill in the blank issue, psycho-emotionally, and then how can I partner with you right now to be able to have you have a better rest of your day. That's it, just for right now. That's all we have. It's right now.
Doc, how much time do we have? I know.
Yes.
I borrowed you. I pulled you out of your busy schedule. 5 minutes.
Okay.
I know, honestly, we could go on and on and on, and I feel like we've just gotten started. Um, but I think I want to ask, maybe perhaps in closing,
Sure.
having there's a lot to think about, a lot of food for thought. I'm taking it in as I'm sitting here right now. Most importantly, how to change the narrative, because as you mentioned now, it's easy for as a physio to say, well, don't pick up 10 kilogram, but we forget that this person has a child at home that they have to pick up, and for them, what's most important is that child is not 10 kilogram, it's their baby. It's not range of motion, they can't get dressed.
That's right.
Or they can't wash themselves and their hygiene. There's a lot of things that are impacted just from shifting the perspective from the impairment, which is just the body structure that we've been taught,
Of course.
to more so the person and seeing them for who you are, because that's where the journey starts. To all the therapists that are firstly terrified of getting into cancer rehabilitation, and therapists who are in this, and even doctors and other healthcare professionals, what can you say to them, just in closing, and to the patients that have got recent diagnosis, that are currently going through the journey of receiving treatment or any modality, that were previously diagnosed? What words would you have for them both?
2 words. Be present. Be authentic. Be who you are. It's an emotional time, and perhaps the agenda that we might have had in mind to make a difference, it's not our agenda. It's their agenda. So I would say, be present. Even how uncomfortable you might feel in the moment. And certainly for us as physios, it does have the, how am I going to do this? How am I going to manage this patient? What kind of cancer is it? What plan of care am I going to put? So it's a very interesting inner dialogue that we have, is how am I going to serve? But when we take a breath and we could be just fully present, the patient knows. That patient knows that you have them. You have them. And there are moments that we may not have an answer. They may ask us, okay, am I going to survive this? Am I going to get through these treatments? Do I stop my treatment because I have all these neuropathies and fatigue? And then what are we going to say to that? We are here to be present and guide you hand in hand. We're hand in hand with this. What do you need for today? What do you need for this week? That we could plan and pace and improve how we go forward to really live life vibrantly, because that's the goal for any human, is living fully and completely in all domains of their life: mind, body, spirit, and ultimately the linkage of family and community, because that's really all we have, is just this day to be present.
Professor Mary Lou Galantino, thank you so much. Like I've said, this was beautiful. This was beautiful. And since our our conversation last week, after the workshop, when we were just talking about life, your energy is so infectious. It's beautiful to be around you, see you interact with different people, some of them that you don't know, and your response to your calling is evident in everything that you do. It's amazing that you are always open to serve, and you're just saying serving does come with understanding who you are serving, and I think you embody that so beautifully. So thank you so much for coming to the podcast. In the conversation, I know, like I'm saying, it could go on and on and on. I wish you all the best.
Thank you. I'm so
in
honored
years to
for
come,
the opportunity.
and for the trip back to the US. Thank you, and thank you.
Thank you. You are amazing. You have that presence. You ask provocative questions, and in your podcast, may it always be successful so that you get to the core of every person you interview. That's what I wish for you.